Cancer is a rising problem in India. The rising in number, although the incidence remains static from last 2 decades, it means the number per 100,000 remains same. But the baseline numbers are on the rising trend because of availability and accessibility of tumor facilities all over India. And there are 2 or 3 more reasons why the number are increasing. First and foremost is the urbanization, that we price that we pay to the urbanization is in the form of cancer. The urbanization is there is rapid and unplanned urbanization have many negative social, environmental, health impacts, which hits the poorest at the most. The urban incidence of cancer is 100 per 100,000, and in mid-sized town, it would be 60 to 70 per 100,000, and in rural India, it is 40 to 50 per 100,000. And so we say that we are much safer in our rural pockets than in the Gramin Bharat. We are much safer. And this data also, if we compare this with urban, with the Western, the numbers are much higher in the West. In UK and USA, numbers are 300 to 350 per 100,000. Despite of all these facts, there is the one positive things to all of it. That 70% cancers are preventable. 70%, that is 2/3 of cancers are preventable in India. These constitute the 70% cancer that are preventable are caused by tobacco-related diseases, tobacco-related, infection-related, and the obesity-related. So the question arises: how will you prevent these 70% of cancers? The number one is tobacco-related, second one is infection-related, and third one is obesity-related. The 40% of these and 20% are the tobacco-related cancers. In India and West, there are 2 different types of tobacco consumption are there. In India, mostly the cheap tobacco are used, smokeless tobacco are mostly used in India, rural India, and in West there is smoked tobacco are mostly used. So the type of cancer that affect the population are much different. In urban metropolitan cities and in West, the lung cancer are more in number, and in rural India, there mostly are the oral cavity cancer that are caused by the tobacco chewing. If we want to overcome this problem, the government should implement the diet in tobacco taxes and should ban on the tobacco ads, the advertisement of tobacco on the print media and the social media, and ban on the sale of gutka. The Maharashtra is the state which is forefront in ban the sale of gutka. Before 3 to 4 years back, the results are also encouraging. The number of cases of oral cavity cancer are on the decreasing trend in Maharashtra. The second one is infection-related cancer. There, the number of cancers are caused by infection like cervical cancer, penile cancer, anal cancer, oropharyngeal cancer, hepatitis, hepatocellular carcinoma, and all. Most common cancer causing virus is human papilloma virus. Human papilloma virus causing cervical cancer in women and penile cancer in men, and also causes oral cavity cancer, oropharyngeal cancer, anal cancer, and vaginal cancer. Then the question arises: when there is infection, if we cut down the transmission of this infection, we can control the disease. By cutting down this transmission, the ways that we use good personal hygiene and good sanitation and availability of running water with privacy of bathrooms and circumcision. The data also shows the good sanitation facility and availability of running water can decrease the number of cancer cases. Like in Mumbai, the incidence of cervical cancer 2 decades ago, 25 to 30 per 100,000, and now 8 per 100,000. And in interior of Maharashtra, one small town is Barsi. The number are in rural Barsi, the number is 30 per 100,000 now, and in urban Barsi, which is 25 kilometers far from the rural Barsi, the numbers are 15 to 20 per 1,000. So we see that the availability of running water and sanitation facility in urban Barsi decrease the number of cervical cancers. And also we can check this number with Then the circumcision is which are commonly practiced in Muslims. The number of cervical cancer in Muslim population in Barsi 5 per 100,000 30 years ago, and today also 5 per 100,000. And in Mumbai, the number of cervical cancers in Muslim population 30 years ago is 5 number in 5, and today also there is 5 per 100,000. So with keeping the personal hygiene, having circumcision, HPV vaccination, we can control the HPV transmission and HPV infection and also defeat the cervical cancers. The HPV vaccination most widely used in West. HPV vaccination trials that are conducted in West shows that the CIN cancer numbers of CIN cases are decreasing after using HPV vaccination, but the invasive carcinoma cancer cases are not. I can't say clearly that the number of invasive cancer decreases or not because of the time gap between CIN conversion to invasive carcinoma is approximately 30 years. So we are less mature data to say that the HPV vaccination causes the decrease in cervical cancer cases. To overcome this gap, the India most widely used screening program in India. So in the name of visual inspection of visual inspection of with acetic acid or pap smear, to overcome this gap, reduce the 30% cancer deaths in women in cervical cancer in the current decade. Everyone should get vaccinated with HPV vaccine in the age of 9 to 14 years with the 2 doses with gap of 6 months, and at the age of 15 to 45 years, 3 doses that should be given the interval of 0 and 6 months. And the second infection in episteal bar virus causing Hodgkin's lymphoma, nasopharyngeal carcinoma, Burkitt's lymphoma, and all and some other diseases like hepatitis, multiple sclerosis, inflammatory bowel disease. And some other infection causing cancer are name of H. pylori causing stomach cancer, hepatitis B and C virus causing hepatocellular carcinoma, HIV/AIDS causing scapulosa and NHL, cervical cancer in women, and cholangiocarcinoma also caused by viral infection and usually that of stomach cirrhosis. The obesity is one of the most preventable cause of cancer. Our city, the obesity is essentially in our cities. If we look at our school nowadays, the number of children are going to school are obese, are severely overweight. So we say that in the current, if these children become adult in 20 or 30 years, the obesity problem is much bigger problem in India in next 2 decades. So we have time to overcome this problem. The 20% of cancer burden in urban India due to obesity, including uterine cancer, breast cancer, kidney cancer, colorectal cancer, lower esophageal cancer, and upper stomach cancer. There are the weak links between the obesity and 7 other types of cancer, like gallbladder cancer, pancreatic cancer, colon, thyroid cancer, liver cancer, meningioma, multiple myeloma, and all. Obesity is also a very strong correlation with diabetes, hypertension, and heart attack along with cancer. So ये कह सकते हैं कि हर लोगों की एक दवा है, आपको reduce your weight. So collectively, the tobacco-related diseases, infection-related diseases, obesity-related diseases causing the cancer, hypertension, diabetes, heart attack. These are the preventable causes. We can control these, and we can control hypertension, we can control diabetes, heart attack, and cancer also. If we are controlling all these problems, India is 1/3 in the diabetes, hypertension, and cancer as of what today. If we control this 2/3 of the preventable causes, India will be the only place where we should live happily and safely. Thank you so much.
Thank you, Dr. Dil. We can take 1 or 2 questions.
Cricket is very nice, but if really thinking that the cancer is not by all this. So, but the thing is, last month only we got the NIH CP case reports. So, the first is, there are 3 points. First is, the cancer is caused by particular cancer. So they have found out different cancer. They are different levels. Second thing is, they have said that the genomic based treatment is really because of the tumor adaptability. So what they have found that there will be have done research and develop proteins. Problem is one gene goes for many proteins. So what they found that many cancers they have found this the pattern is shared, the protein addressing pattern is shared. And third thing they have found out pattern of DNA solution. That is the addressing of B gene by DNA solution. So this is very complex, but in our earlier ancient knowledge, they have said in a simplified form that is Utpad based group. What is Utpad? Utpad is a proto-composite. Then there is people substitute. And then what is group? Group is a DNA gene. So and there is they have got somebody by that is their different thing occurring at the same time. And this was said by none other than God within us. So, Google Jan Austrides, just simply they have, it does not Austrides, there is a Google science. So, the obvious conferences. So, Nadina said about this. So, that there is mention, he used to check outside the conferences and he used to say that what the other is, what other is saying is wrong. What he was saying is that there is a particular act. That is, the processes are happening one after another. So that was the level of, and one more thing what Aruna said, that this all disease occurs by the aspect of stress. So what he has given example is pregnancy. Pregnancy, delivery. Delivery is the most stressful event. So what he said actually was that pressure of oxygen